And what I'm here to talk to you about is radiation safety as it pertains to procedures that we do up on Ward 5A, where you may have some involvement. Procedures we do there are both implants and something we call a radiopharmaceutical or a swallow type therapy. They're all for treatment of cancers. They basically operate the same way. We put a patient in radiation isolation. We introduce the radioactive material either in liquid form or a sealed source into the patient. The patient is then maintained in that room while the therapy goes on for a specific period of time, either until the liquid radioactive material clears the patient's body sufficiently enough so that they can be released out of the hospital, or after a specific time frame for the implant, we want it to deliver so much dose, the time has gone by, we remove the radioactive materials from the patient no longer has any radiation associated with them, they can be released from the hospital at that time also. Whenever there's a radiation implant or a radiopharmaceutical swallow therapy going on, we will post the room when the therapy started. That means when the radioactive material has been introduced into the patient's room. And what we will do is we'll put a sign, just like this. It'll have a yellow background with magenta or black lettering. It'll say caution radioactive material. Only when this sign is present is there radioactive material or radiation present in the room. When it's gone, everything's clear. Either the room has been cleared, all the radioactive material has been removed, or the radiation sources have been removed from the patient. So it's safe to go in without any specific precautions or concern for radiation exposure. In addition, what we do is we put another sign on the door. We put this across the door on a rope. And the first part of the sign says, if you have any questions or concerns, contact the nurse's station to find out what's going on in there. Because, you would hope that somebody would say, hey, there's something going on here, maybe I don't understand or know, let me go down and find out why I am going in there, if I actually have been called to go in. In addition to this, what we do is we attach 2 items to the bottom of the sign. One of 2 items, I mean. One of the items is this sheet. As I mentioned, we do 2 types of therapies, and they're done on 5A. For the reason that we do them on 5A is that we're able to seclude the patient far enough away from the general patient population and away from other staff to ensure the safety of all people involved. The other thing is 5A has 3 rooms at the very end of the hall that have a minimal number of inside walls. They do have outside walls. Radiation only travels in straight lines, doesn't bend, doesn't turn corners. So if we have an outside wall, we don't have to worry about shielding or concern of who is on the other side of that wall. It's just air. So if we have a patient on an inside wall, we have to take some measurements or precautions to ensure that they don't receive an excess amount of radiation during their stay, or any member of the general public that may come in and see them. So that's why we use 5A. It allows us that capability in those areas. So as I say, we do 2 types. We do an implant and we do a swallow. For the implant, the only thing we do is we introduce a sealed source into the patient's body, someplace. It can be a vaginal insert, or it can be in a mass such as a sarcoma in an arm, a leg, some body part, massive tissue body part that we would use. As I say, that's a sealed source. There's no contamination, there is only radiation exposure. So what we want you to do in order to minimize your exposure is to use 3 concepts: time, distance, and shielding. We're all being exposed to radiation every day, just through natural background radiation. I'm standing here in this multi-story concrete structure. If I brought a survey meter in here and turned it on, it would start clicking. And that's because of natural radiation in the walls, from the cosmic rays from the sun. It'd all be penetrating and it would be picked up by that survey meter. In addition, what we want to do is we want to minimize everybody's exposure to this any additional radiation. On average, everybody picks up about 1 milligram, which is a unit of radiation dose measurement, per day, just through normal existence. There's really nowhere in this hospital that you would be involved with any patient where you could come in contact with anything greater than that. So you're really not going to be picking up anything or being exposed to anything greater than what natural background is to you on a daily basis. So with the implant patients, back to them, We put a sealed source in them. It's left there for a specific period of time to give that dose to that area, and then we remove it, put it in a sealed container, and take it down and store it away. Again, there's no hazard as far as touching or contamination that you have to be concerned about, but there is that radiation source. So we talk about time, distance, and shielding. You minimize your time around a radiation source, you minimize your exposure. You maximize your distance, stand further back from the radiation source, you're going to minimize your exposure also. The last thing is shielding. For the implants, we normally put a large shield up alongside their bed. We ask, if at all possible, when somebody has to go in either from respiratory therapy or one of the nursing staff or physicians, that they can work or deal with the patient from behind that shield. That'll help reduce their exposure too. The shield only goes up part way. That's because it protects the most sensitive human parts of the body, which are the reproductive and blood-forming organs of the human body. Those are the most sensitive to radiation exposure. And those shields work significantly because I've taken measurements on both sides of the shield to verify that they do operate. So when you walk into one of those rooms, the only thing you have to be concerned about is time, distance, and shielding. And we also want to know how much you've been exposed to. So the only item it says on this precaution sheet for those of you that are entering the room is you need to wear a pocket dosimeter, or radiation monitoring device. And that's what this is. You'll find them outside the room in a box with a sign-in sheet. I'll go over this a little bit further at the end because you use them for both types of therapies. So that's the only thing you have to take in with you. But you want to minimize your time, maximize your distance, and work behind the shielding if at all possible. If you have to record anything once you're done with whatever you're doing, move back at least 6 feet or walk outside the room to take any of your notes or write anything down. You can bring anything in the room with you and take it out when we're doing an implant. There's no concerns or no precautions. Now, the other type of therapy I mentioned was a swallow therapy. Swallow therapies are done primarily for metastatic thyroid disease. These patients have all had thyroid cancer, they've all had their thyroid surgically removed. What we're treating is metastatic sites adjacent or in the area or have spread through other parts of the body carrying this cancerous tissue associated with the thyroid. We use a radioactive form of iodine which goes to the thyroid. So this remaining thyroid tissue absorbs or takes this iodine up. It's radioactive iodine, and that's what is used to kill the cells. The patient, though, only absorbs a very small amount of what we give them. That's why we have to give them such a large dose to make sure they get the maximum amount possible. The remaining material is not taken up by any other body part. It's eliminated from the patient's body through normal bodily excretions, primarily by the urine and fecal matter. So basically it's all flushed out of the system. However, a very small amount of it does come out through the pores, since it does mix with bodily fluids. So anything the patient will touch, either with the palms of their hands or on the soles of their feet, this transference of contamination will take place. So in order to preclude that, we cover everything. We reduce the amount of furniture in the room, and we seclude the patient again, just like with the implant. However, we remove all the furniture except what is absolutely necessary for the patient, and then cover everything in the room with some type of either absorbent or covering that won't absorb the radioactive material. So it makes it easier for us to clean up the room after that, because we take care of cleaning up it, all the radioactive materials. When we remove the radioactive material from the implants and from the swallow patients, we clean up all the materials in the room. Then we turn it back over to housekeeping, who then comes in and sanitizes the room so they can turn the patient back in. It takes us about an hour and a half to set up a room for a swallow, and an hour and a half to take down a room for a swallow. So we're pretty much bound up for an entire day almost when we're doing one of these patients. So in addition to the caution radioactive material sign that goes on the door when we start the swallow, and also enter, but find out why you're going in there, the other item that's attached to the bottom of that is this. This is different now from what the previous form showed. The previous form only had one item, your pocket or radiation monitoring device. This device, because there is contamination, something that you could pick up and transfer to yourself, we want you to use universal precautions. If you use universal precautions, you're going to minimize any contact exposure you potentially could come away with. So you're going to go in there, you're going to put disposable gown, disposable shoe covers, and gloves on, in addition to your radiation monitoring device before you enter the room. These items are all available in the cart or in the drawers outside the room. So you put those on, you walk into the room, again using time, distance, and shielding to minimize your exposure, using the gowns and everything that you've just put on to minimize your contamination exposure, and you do what you have to do for the patient. However, you want to minimize the things that you're going to take into the room because they can become contaminated. So only take into the room what is absolutely necessary, and be aware anything you take in the room, be prepared to leave it in the room because it can be contaminated. Now, if you need it back after the fact, let us know. We will ensure it gets cleared or cleaned and returned to you. If it can be disposed of, that's fine, then we'll go ahead and take care of it when we're cleaning the room up to get rid of it. We take care of all the trash, all the food matter, all the materials, the bedding, everything. We take it down, we hold it for a specific period of time until it's no longer contaminated, and then we either send it to medical waste or return it back for hospital use again. Now, when you're coming out of the room that you've been in that had this sign on it, there's a specific procedure that you're going to need to go through in order to safely take off the protective clothing that you've been wearing in order not to contaminate yourself or contaminate other areas of the hospital. That procedure is posted in the room. You'll see two postings routinely that look just like this sheet. In the swallow room, there's a large shield right by the door, right up close at the entrance to the area. On the interior side of that shield, you'll see one of these scripts posted. The other place you'll see posted is on the wall locker, outside the contaminated or controlled area. What it's there for is for you to refer to it before you walk in. Again, this is the procedure we want you to use step by step to come out of that room. So familiarize yourself with this. I don't expect you to memorize it because that's what the other one on the inside is for. So on your way out, you can stand there looking at it because it's facing you on the inside, and you can go through it to come out of your protective clothing. On the floor is a plastic mat or pad that says step-off pad. It's a clean item. You don't step on that until you've taken off all the contamination, or basically your contaminated booties, and then you take off the remaining items and put them in the designated containers as described here. Any questions about any of those items? Again, there are two types of rooms. They're each delineated as radiation isolation rooms, all the same. Time, distance, and shielding minimize your exposure. For the room that has contamination potential in it, it tells you that you have to dress out more than just usual. So that room, you want to take the extra precautions of using universal precautions, in addition to your time, distance, and shielding, and use the procedure to remove those precautions when you leave. The last item I want to talk to you about again is the radiation monitoring device. You'll use this in both instances. What you do is when you take one, it sets up a radiation current in it that changes a reading inside when it's exposed to radiation. They're in a box associated right outside the patient's room, so you'll take one. Each one of these has a little number and a little pink or white label on it. That's the dosimeter number. So this form will be on a clipboard. We ask you to print the information on this form clearly as possible, because if we have a question or a concern, we want to know who to get back to. So you'll print your name, don't worry about social security number, you put the date and time that you're taking it. Then it asks for the dosimeter number. That's this number, number 10 on this one, could be 26 or 18 on another one. Then it asks for an initial reading. That's the first reading you're going to take before you go in the room. You want to take an initial reading so you have some baseline to start with. You use this as you would use a telescope. It has two ends to it. One end has a clip by it that you clip it to your uniform when you go in. You look through the eyeglass on that end, up at a light source. Fluorescent light source works fine. So you place it against your eye, look through it. What you'll see is you'll see a scale that looks like that, going from 0 to 200, with increments in it and a hairline running through it. Each of the increments is 10 units. It says milliroentgen across the top. So you want to look through this and look up at the light source and visualize that unit, okay? If it is not in that form, if what you see is in a different rotation. If it's like that, then you basically, what you want to do is rotate the barrel while you're looking through it until it reads like that. You always want to read it in that plane. So you read the number through which the hairline is moved. That's your initial reading. And you write that on the form under initial. Clip it to your uniform somewhere between your shoulder and your waist. Go into the room, do what you need to do, and come out. When you're done filling out all your paperwork, doing whatever else you want to do, finish filling out my paperwork, the final reading. Read it again, see what the hairline says, put your final reading there, you can see what you've picked up. Don't be surprised if you don't see any movement. It takes a significant amount of radiation to cause any harmful or significant or any type of biologic or medical injury to a person. It also takes a significant, not that much radiation to cause that hairline to move. They are very sensitive, but they're only sensitive to the point that it could potentially mean that you've received enough radiation to cause some type of biological injury. A small amount of biological injury is not harmful. The body repairs radiation injury just like it repairs any physical injury, like a cut on our finger, on a routine basis. So normally you won't receive anything because we're all being exposed every day to radiation. So you get an idea of what you picked up. Now, you're allowed as an infrequent person working in and around radiation to pick up 500 millirem units per year. No one in this hospital ever reaches that. Those of us that work frequently with radiation never reach that routinely. So I know that you're never going to reach it. So on a daily basis, what you could pick up without any concern would be 100 millirem, and I don't expect anyone to ever pick that up. So you sign it in, you put the dosimeter back in the box, and then you're all done. Now, I don't expect you to remember all that about this dosimeter either, so the instructions are written on the back of the form that's on the clipboard to include what a scale looks like with the hairline going through it. So just follow this procedure, fill it out, and it's all there for you.